hello, 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 hello. It's Yay, aka Madishay. And today I'm going to share some of the risks when having lower and upper jaw surgery and what you need to be aware of while recovering. When it comes to risk, there are several. The primary one has to do with taking out the wisdom teeth. If you remember in this video, I mentioned how I removed my wisdom teeth for an upcoming agenda. I precluded to jaw surgery. The risk of taking out wisdom teeth, not just in my case, but in any case, is hitting the nerve that provides sensation to the chin. And if that happens, your lower chin could become numb. Another risk is a hole can form when you take out upper wisdom teeth. Some of the risks of having jaw surgery include damaging the nerve that provides sensation/feeling to your chin. For this type of procedure, the nerve needs to be exposed and repositioned to move the lower jaw. And in order to move the lower jaw, bone is exposed and therefore the nerve is out there in the open. Numbness of the lower chin is unavoidable. As I'm recording this video, I am 6 months post-op and my chin is still quite numb. Something else to consider is the possibility of being wired shut for more than 3 weeks. Now, I was not wired shut, but due to the significant damage that the grinding did to my teeth, the surgeon had trouble stabilizing my jaws. You can brush your teeth, but I couldn't brush my tongue. The amount of gunk left from the liquids and bacteria is not a pretty sight to see. Let's move along, shall we? The doctors would tell you to take off at least 1 week from work, and depending on the amount of physical labor you do, 2 weeks might be substantial. If you are a student, you can go about your study routine shortly after jaw surgery. I am here to tell you though, as someone who has gone through this process, do not get this surgery during the fall or spring semester or while working at a job that can't seem to grasp the mental, emotional, and physical toll this surgery will have on you. I suggest having this surgery after taking your summer classes if you and your doctor's schedule allow. That's what I did. Speaking of summer classes, if you want to learn how to increase your class participation percentage, which is a metric that affects your overall grade, click this video here to watch. Another thing to note is your throat will be sore after surgery. You are able to speak, and ideally, if you want to decrease the soreness, try to use your vocal cords before you leave the hospital. It will feel uncomfortable at first, but the more you talk, that uncomfortability will go away. The first 3 days are the most crucial, and the first 3 weeks are quite intense. I am blessed and fortunate that my mom is a nurse, so she was able to take care of me. I understand others are not so privileged, which is why I'm making this video, so you can at least be aware, because nobody is coming to save you. My mom had to go back to work, so I had to learn how to do things on my own. I was not ready to go back to normal life. I am 24 weeks post-op as mentioned before, and there are things I still do not do. Side effects arise all sorts of times and weeks in the recovery process, which I documented and will share in upcoming videos. So please make sure to subscribe so you won't miss those videos. I have had periodic visits with the oral surgeon and will continue to do so for at least 1 year. My suggestion is to get this surgery during summer break and when your responsibilities are few. This surgery is not fully covered by insurance because you still have to pay whatever insurance does not pay out of pocket. You should see how much OR costs alone. During the initial consultation with the oral surgeon, I was told surgery could take 4.5 to 5 hours. I suppose mine was 6. I do remember that surgery time was 7:30 a.m. and I stayed overnight so the doctor could monitor my pain levels. That's standard. If you are wondering what items to bring to the hospital, then scroll below to the description box because I created a free packing checking list which you can download. Another thing to note is morphine will be given to you to help with the pain in the hospital. But once you leave the hospital, the pain will be difficult to ignore. But don't worry, your doctor should pre-order your prescriptions in advance. In my case, the morphine gave me a headache, so the dosage was lowered. My tip is to anticipate the pain. Don't wait before it comes before you take action. If you like this video about the risk and recovery time of upper and lower jaw surgery, please like, subscribe to the channel for more jaw surgery videos, and hit the notification bell so you won't miss another video. If you can't wait for my next video regarding my braces journey, check out this video right here on what is an anterior open bite and why orthognathic surgery is necessary to fix. Thank you so much for listening, and I'll see you in the next video. See ya!